morning to you, South Africa. This is the South African Morning. I'm Tami Ngubeni along with Gareth Edwards. Now, half of the world has no access to essential health services. The latest data shows that 2 billion people face financial hardship due to out-of-pocket health spending. And I'm sure many of you can relate to that. Now, this past weekend, the UN General Assembly held a high-level meeting on universal health coverage. Now, Doctors Without Borders want the lack of access to be highlighted. Joining us for more on this is Health Policy Advisor at Doctors Without Borders, Vinayak Bhardwaj. A very good morning to you, Vinayak, and thank you so much for your time. Talk to us about the universal health coverage. This was one of the highlighted areas when the Sustainable Development Goals were put together in 2015. As the name says, it is universal. But how does this apply to different countries, and how does the implementation apply to various territories?
Well, thanks, Tami, and good morning to your viewers. So we as MSF observe the way UHC plays out in a multiple of contexts, and the goal is, in terms of the UHC index, which is the kind of metric that they use to describe the host of services that are provided, they look at mainly provision of maternal and child health care, care for infectious diseases. Then they also measure health services capacity, as well as care for newborn children and maternal health. So if you look at the latest tracking report from which you cited the headline statistic, that hasn't really been improving at all in the last 5 years that data was being collected during between 2015 and 2019. And although we don't have specific data on the same level for all countries during the pandemic years, we can assume from some of the individual case studies that have been studied that this hasn't really improved during the pandemic. It's probably gotten worse. And MSF's experience in the field is through looking at, for example, how free healthcare initiatives for mothers have been scrapped in countries like Burundi or Zimbabwe. And in fact, they've replaced them with fee-paying services, which, if women can't afford, are then held in detention in those hospitals until somebody from their families can make the payment. And we're also seeing that, for example, migrants get excluded from health systems or are asked to pay exorbitant rates in order to access basic services that should be available to all. Or then we're seeing that in conflict settings, there's just no healthcare provided whatsoever, and no provisions made for subsidized care to those who can't afford it. And that's affected areas are where 2 billion people of the world's population, a quarter of the world's population, live. And then finally, what we're also seeing is that UHC, while a great idea, the UHC 2030 is an important set of goals to strive towards, the modality of trying to achieve this purely through health insurance or social health insurance mechanisms is ill-suited or poorly adapted to the world as it actually exists, where you have something like 60% of the world's workforce working informally. So, and where social health insurance contributions through employers and so on is not so easily possible. So really, at this stage, unfortunately, the state of UHC is, as you pointed out in your opening sort of intro, not great. Lots of people being left behind.
And with that being said, what role does primary health care play? Because you did mention the social matrix and the social strata not being able to provide the outcome that you are wanting. So surely then primary health care has to fit in there somewhere.
Absolutely. I think that primary healthcare would be critical, and more importantly, primary healthcare that is affordably accessible and ideally freely accessible to the largest number of people who need it. And this is not just our view, this is the view of WHO itself. It's the view of the World Bank, which has recently released this report. And in the UN high-level meeting, it's something that they've committed to. But together with the commitment to primary healthcare, what we think is needed is also a commitment of resources. Simply saying domestic resource mobilization is the way to achieve this ignores the fact that for many countries, domestic resource mobilization is a very, very difficult to achieve possibility. So external financing will be needed. And right now, what we're seeing is the slashing of aid budgets by countries like UK or Sweden. We're also seeing diminishing of interest in things like PEPFAR. So these are very worrying trends that don't suggest that we are anywhere near approaching universal health coverage, especially through the modality of primary healthcare, which you correctly identify.
Vinayak, the provision of health and adequate health care is a basic human right. And from what you are describing to me now, it sounds like the model that is currently being put in place is not working at all. What are some of the solutions that you're now going to be putting in place, specifically considering that you are supposed to be halfway to that 2030 mark?
So what we propose in our report that we released a couple of days before the UN high-level meeting is that there needs to be a back-to-basics approach. There needs to be thoughts about what we measure when we measure whether universal health coverage is actually being expanded. So, for example, until recently, there was no deliberate monitoring of people who forego seeking healthcare because they can't afford it. So we think that's something that needs to be urgently addressed. We also want priority support to be towards these free healthcare initiatives like the ones I described for maternal facility-based delivery, because what we've seen is that as soon as you impose fees, that's something people are very sensitive to, and they tend to not allow for facility deliveries. So that's something that needs to be urgently addressed. And then what we also think is that there needs to be more engagement between patients, communities, and civil society in the processes that are used to develop universal health coverage plans, rather than simply treating it as a bureaucratic exercise in box ticking. And then, yeah, lastly, I think proactive targeting of vulnerable populations, not only for their own sake, but also for the broader population health objectives, would be an important way to address this.
We'll leave it at that for this morning. Thank you so much for your time. That's the Health Policy Advisor at Doctors Without Borders, Vinayak Bhardwaj, certainly talking about the critical state of universal health coverage and the fact that it is actually a global pandemic in itself. The targets that have been set for the Sustainable Development Goals not being met at all. The world is facing issues of migration, of refugees, financial crises. So even the drying up, Gareth, of funds to go into, crisis-hit areas, that also is a problem, and that is dwindled.
And it is. It's the danger of those who are going to be left behind. So the word universal starts becoming a bit of a grey area, because it depends where these people are, what kind of needs they have, and how they can be provided as well. And that's always the danger when it comes to anything universal, is who is not being included in that.